The Care About Physical Activity resource highlights to managers and staff in a care home the importance of moving more often. It explains the difference regular physical activity can make to everyone's health, well-being and overall quality of life. The clear message is that doing something is better than doing nothing.
When we have residents that come into us from their own homes, you find that their mobility can be quite poor, but with the support of the staff, as time goes by, you see a massive increase in their willingness to partake in physical activities and their physical ability to.
I used to enjoy being a marathon runner, so I ran everywhere I could. Regardless of how bad your mobility is, you've got to try and improve it, and the way you improve it is to be active. There's still small things you can do. You know, you can sit and you can exercise your ankles and your knees. You know, you can do small things even sitting down. It's very important to keep as fit as you can.
Well, the care home help to keep Father going physically on a day-to-day basis. They're encouraging him to come down to breakfast, and it starts, I think, with simple things like that.
A key to promoting physical activity is the way in which it can be built into the everyday life of the care home using activities of daily living, such as rising from a chair, walking and moving around the care home and making use of the outdoors. Research tells us that there is a steady decline in physical activity throughout life into later life, and among residents in care homes, physical activity may have disappeared completely. This can have a major impact upon an older person's well-being and independence, and their ability to carry out simple activities in daily life.
It's important for residents of care homes to be active because we understand a lot about the benefits of physical activity and how they can help health and well-being and independence in later life.
The benefits of physical activity for older people are absolutely huge. Physical activity benefits people not only physically but also mentally, psychologically, emotionally and spiritually. And I think that that's because people have a huge desire to be active. And if you can't be active, then you feel that you're not able to go about your daily business and do all the things that you would like to do. So it's really important to try and remain active, no matter what age you are or stage in life. And if you've got hobbies you enjoy doing or whatever it is in life that motivates you, that just helps you to get up in the morning, then it's really important to continue doing that and to be as active as you possibly can.
The resource pack is based on a simple self-assessment process. The self-assessment should be completed by a care home manager and another member of staff. This will help identify the good practice taking place in a care home and also highlight areas where improvements could be made. In the resource pack there is information and tools to help make any required improvements. A guide to an active life called Make Every Move Count, the accompanying DVD, and a poster for care homes to show their commitment to the implementation of the resource and enabling their residents to be more active daily.
I think that the resource will help care homes in many, many ways. It's a fantastic resource. It's been tested with care homes. So it's very practical, it's very logical, it's easy to find your way through. But I think whenever anywhere is making changes, it can always seem difficult at first. And I think this resource provides simple, practical ways that you can make things a little bit more active for the residents in the care home.
The resource will actually encourage people to look at new ways of introducing activity to people who are living in care homes. It will encourage staff to be a bit more creative and also give them signposts as to how to increase physical activity for people.
Perhaps the perception is that it's purely doing lots of physical activities, but actually by introducing the resource they can understand that these activities can be broken down and they can be small achievable tasks and goals that they can do with residents, and they can see improvements with the residents as well.
I think the two things will be giving staff permission to spend time with people and enable people rather than do things for people. And I think that quite often staff don't have, or they feel that they don't have good ideas on how to help people be active. I think the resource will assist with that too.
The resource is based on 3 key principles for promoting physical activity. Principle 1. Physical activity participation. This is the overall aim. It refers to what can be achieved through implementing the improvements identified through the self-assessment process. Principle 2. Organisational care home culture and commitment. Managers and senior staff in particular should be committed to making opportunities to be more active every day. A supportive and appropriate environment is necessary, and everyone should be involved.
We do have chair exercises, and it's held in here, and they're excellent because if you're not able to go for walks and so on, at least you get a lot of exercises that strengthen the muscles in your legs and in your arms and chest body and so on.
I see folk getting supported with all different daily activities, being physical, social, and I feel the benefits are you see that their self-esteem totally boosts, their confidence comes up really greatly actually. Just working with each individuals with even personal centred care, getting to know the person, knowing what their likes and dislikes, really benefits people because you can do what's most meaningful to them.
We try and incorporate things that people like because we'll ask them. We'll ask people what they enjoy doing, what did they used to do, things like that, and we'll maybe bring it into a group of people that maybe like dominoes, games and things like that, or maybe people that like exercise, and we try and encourage everyone to join in.
Principle 3. Community connections and partnerships. There is so much to gain from formal and informal links with the local community. Working together, sharing ideas and resources bring more opportunities to be active. It also encourages residents and staff to be part of and contribute to the local community.
We had a lady that came to stay with us that expressed a wish to go swimming, but before she came with us she had a stroke and she lost her confidence to be able to go swimming. But we were lucky enough to be part of a pilot scheme that gave staff training to support her in the pool. So now on a weekly basis we take her to the local leisure centre, and she really enjoys going swimming, and the benefits from that are she's more physically active and she's building up the strength in her legs that she'd lost from the stroke.
It was tough, but it was good exercise and I thoroughly enjoyed it. There were 2 very nice girls in the pool as well, you know, trained. And it was fun. I think that's the best thing, it's fun.
All the residents have a care plan and our activities coordinator, she speaks to the residents as well. We have in our care plans as well, we've also got their personal history, so we know things they've done in the past. So we try and, you know, things they've maybe not done for a while or they want to try, we try and support them so that they can try something new, or, you know, even if it's things like go to the library, we help promote that as much as possible.
Physical activity helps to maintain physical function, activities of daily living, mobility and independence, and also helps to maintain important social connections. It also can reduce the risk of falls. It is important to remember that the needs, interests and abilities of the individual must be the starting point for promoting physical activity and encouraging residents to take part. Understanding any previous successful physical activity experiences, their personal beliefs and their expectations of others should also inform personal choice and help identify suitable daily, weekly, monthly and annual activities. The Care About Physical Activity resource pack will be issued to every care home for older people in Scotland and be available on the Care Inspectorate website at www.careinspectorate.com. There will be an app available to support implementation of the resource and to help staff see opportunities to enable those they care for to move more often and be active daily. Don't forget, this is everyone's business and everyone benefits. Everyone should take every opportunity to move more often, get up and go, and enjoy an active and full life.